Welcome. Today, we're diving into a topic close to many hearts: pediatric care for type 1 diabetes. Picture this: a child's laughter fills the air, but behind that smile, there's a unique journey. From insulin dosing adjustments to navigating school life, join us as we explore the world of tiny superheroes and their caregivers, learning how they tackle challenges, celebrate victories, and create a brighter future. Pediatric care for type 1 diabetes involves a multidisciplinary approach to ensure optimal management and support for children living with the condition. Here are 4 crucial points. Number 1. Early diagnosis and education. Recognizing the symptoms of type 1 diabetes in children is crucial for initiating prompt treatment and preventing complications. Common symptoms include excessive thirst, frequent urination, unexplained weight loss, fatigue, and blurred vision. Pediatricians play a vital role in identifying these symptoms during routine checkups and wellness visits. They may conduct blood tests to measure blood glucose levels and confirm the diagnosis. Pediatric healthcare teams provide extensive education to children and their families upon diagnosis. Children are taught how to monitor their blood sugar levels using glucometers and interpret the results. They also learn how to administer insulin injections or use insulin pumps under the guidance of healthcare professionals. Early diagnosis enables timely intervention, while comprehensive education equips children and their families with the knowledge and skills needed to effectively manage type 1 diabetes and promote optimal health outcomes. Number 2. Individualized treatment plans. Pediatric healthcare teams conduct a comprehensive assessment of the child's medical history, lifestyle, growth stage, activity level, and family dynamics. Children with type 1 diabetes require frequent blood sugar monitoring to maintain stable glucose levels. The frequency and method of monitoring, for example, fingerstick glucose testing, continuous glucose monitoring, are determined based on individual needs and preferences. Registered dietitians work with families to develop personalized meal plans that consider the child's nutritional needs, preferences, and lifestyle. Physical activity is important for overall health but can affect blood sugar levels. The healthcare team provides guidance on adjusting insulin doses, monitoring blood sugar before and after exercise, and managing hypoglycemia during physical activity. Recognizing the emotional impact of living with type 1 diabetes, pediatric care teams offer psychosocial support to children and their families. This may include counseling, peer support groups, and resources for coping with the challenges of diabetes management. Individualized treatment plans empower children and their families to take an active role in managing type 1 diabetes while providing the support and guidance needed to optimize outcomes and improve quality of life. Number 3. Psychosocial support. For children with type 1 diabetes, this encompasses various services and strategies aimed at addressing the emotional, social, and psychological aspects of living with the condition. Healthcare professionals, such as psychologists and social workers, offer counseling and emotional support to children and their families to cope with the stress, anxiety, and emotional challenges associated with managing type 1 diabetes. Psychosocial support equips children and families with effective coping strategies to navigate the daily demands of diabetes management, including stress management techniques, problem-solving skills, and relaxation exercises. Psychosocial support focuses on empowering children and families with knowledge and skills to effectively manage diabetes. This includes education on insulin administration, blood sugar monitoring, meal planning, and recognizing and responding to hypo and hyperglycemia. Support groups and peer networks provide children and families with opportunities to connect with others facing similar challenges. Sharing experiences, tips, and encouragement in a supportive environment can alleviate feelings of isolation and foster a sense of community. Psychosocial support teams identify and address mental health concerns, such as depression, anxiety, and diabetes-related distress, through counseling, therapy, and referral to specialized mental health services when needed. Psychosocial support plays a vital role in enhancing the overall well-being and quality of life of children with type 1 diabetes by addressing the emotional and psychological aspects of the condition. Number 4. Growth and development monitoring. Healthcare professionals track a child's height, weight, and body mass index at regular intervals to ensure that they are growing appropriately for their age and sex. Type 1 diabetes can affect growth due to factors such as insulin deficiency, fluctuations in blood sugar levels, and hormonal imbalances. Puberty can influence insulin sensitivity and requirements in children with type 1 diabetes. Healthcare providers assess pubertal development, including the onset of secondary sexual characteristics and menstrual irregularities in girls. Type 1 diabetes is associated with an increased risk of bone health issues, such as osteoporosis and fractures. Professionals may evaluate bone health through imaging studies and laboratory tests to assess bone density and markers of bone turnover. Nutritional counseling and vitamin D supplementation may be recommended to support bone health. Dietitians work with families to ensure that children receive adequate nutrition to support growth while managing blood sugar levels effectively. Pediatric care for type 1 diabetes is a comprehensive journey focused on empowering children and their families. Through early diagnosis, personalized treatment plans, psychosocial support, and vigilant monitoring of growth and development, healthcare teams work tirelessly to ensure optimal outcomes. Together, they navigate the challenges, celebrate victories, and pave the way for a brighter, healthier future. Thanks for joining us on this journey through pediatric care for type 1 diabetes. If you found this video helpful, don't forget to give it a thumbs up and hit the subscribe button below for more content on living well with diabetes. Together, we can empower families and children to thrive. Until next time, stay healthy, stay positive, and keep spreading awareness. Thanks for watching.